caring for others. We will offer suggestions for how to deal with common caregiving problems. The information presented here is designed to help families directly and to help healthcare professionals in working with families by making them aware of the impact of dementia on the family and also on themselves. By knowing how dementia impacts the primary caregiver and the family system, healthcare professionals can be more knowledgeable about the impact of dementia and better able to help the family and patient through difficult times. The issues and emotions covered here are the ones reported by family and professional caregivers, paid and non-paid caregivers, time and time again. Caring for a person with dementia is never easy. Many caregivers try to do it alone, to provide all of the care without asking for or receiving help from anyone else. Many, no doubt, feel that caregiving is their own problem and that they don't want to impose on anyone else. This can lead to isolation and exhaustion, both emotional and physical. The support of others in the family or in the community is important for providing the best care. Both professional and non-professional caregivers can benefit from finding out the names of organizations that offer helpful services. If you are a paid caregiver, talk with a supervisor or colleague, if one is available, about what is available in your community. Attend training sessions and see if material from previous sessions is available. Look in your community to locate groups that might be able to help with care. Groups like the local Alzheimer's Association chapter, the Area Agency on Aging, local hospitals, and healthcare professionals may be able to get you started in your search. The phone book often lists services under headings like aging, social services, or community services. Becoming isolated from the assistance available from the community or family and friends happens most often with family caregivers, but it can also happen to a paid caregiver who is working closely with a patient who requires a great deal of care. Using all of the resources available in your community may allow you to avoid becoming isolated. Reaching out to others will help you to realize that you are not alone in what you feel and experience as a caregiver. The best way to care for a patient is to care for yourself. Asking for help is not a sign of weakness. It is smart caregiving. To help you cope with caregiving, we offer suggestions for when and where to look for help. This may help you provide solutions to avoid isolation and make day-to-day caregiving easier. Realizing someone has dementia usually happens by observing behavior changes over time. It often takes a dramatic incident like the one you just heard about to make it apparent that the person is behaving differently than they used to.
Where are my socks?
Oh, now, Fred, sometimes I just can't believe you.
What?
Your socks have been kept in the same dresser for 30 years.
No,
Don't tell me you can't find them.
I can't. I tried.
I think you're just getting lazy.
I can't do anything right. I wish I were dead. You'd be much better off without me.
At first signs of dementia, family members and friends may think the person is behaving oddly, but ignore the behavior, assuming the person is having a bad day, or is just forgetful, or is out of sorts, and will soon return to normal.
You know, Jean, at first, I just thought Fred was not paying attention, asking questions over and over again. But now I'm beginning to think there's really something wrong.
Family members and friends may find it difficult to tell the difference between normal memory changes, like forgetting things occasionally, and abnormal memory changes, the sort of severe, persistent memory loss which is part of dementia. The person who is developing dementia and those around him or her may try to ignore the problems or make excuses to cover up the symptoms. As the frequency and severity of the memory loss increases, it begins to become apparent that there is definitely something wrong. And then the worries start. What can it be? At this point, the family may seek the help of a professional. The family physician may refer the patient to a specialist for a workup or may evaluate the symptoms him or herself. Diagnostic testing is necessary to rule out other health problems, reversible dementias, depression, or other conditions that could be causing the problems. An earlier tape in this series describes the workup in detail. Coming to terms with the fact that someone you care for has an irreversible dementia is difficult and can be devastating for family and friends.
But what do I do now? There's nothing you can do to treat this? You mean there's just nothing to do but wait it out? There must be something you can do. I don't think I can cope with this.
Family members may feel very anxious and depressed. They often have mixed emotions. They may feel that everything is changing and out of their control, yet some things remain constant. Their obligations to other family members, employment, and their life outside the family will still remain, and these relationships and obligations may either add further burden to caregiving or may be a source of support. The family structure and the roles each member plays may need to change. Worries over day-to-day issues like wills and important health care decisions can add to a family's crisis.
I don't understand why there are so many policies. Look at this one. Okay, with this one you can use it for at least a year and get $100 coverage per day.
Per day.
Per day, but that's
But
not
just
enough.
for a year?
Just for a year. What is $100 a day going to do? I don't know.
Keeping these things in mind, it is easy to understand why families often feel burdened. Often tempers can flare under this sort of pressure, while other times families cooperate well and are supportive and helpful to one another. Different people have different reactions. The key is to figure out how you, or the families you work with, deal with stress and burden. Paying attention to how you or the families you work with feel and respond to stressors will help you and them set limits and suggest times when either or both of you need help. Changes in the family, difficult decisions to make, and other trials and losses experienced by caregivers and families in the day-to-day care of the demented person bring out many emotions and feelings. Here are some common feelings families and caregivers of demented patients report. Depression. Depression can result from forced changes in lives, the loss of control over circumstances, the gradual loss of the person the demented person once was, and other changes that affect the caregiver's outlook on life. Grief and sadness often go hand in hand. Families often grieve over the loss of the patient's former self and their memory. Caregivers may also feel disappointment over the way life has turned out, lost hopes and dreams. Caregivers may also feel fear and anxiety over having to make serious decisions, like deciding about institutionalization, even when placement provides the level of care the patient now needs. Family members may feel fear when thinking about the future, fears for both the patient and themselves, what will become of the demented person and them. They may fear loneliness, fear the loss of abilities in the demented person, or financial loss. They may also fear that the dementia may be hereditary and that others in the family may develop it. Sometimes people even fear dementia is contagious, that they can catch it from patients, even though they can't. Caregivers and family members may feel embarrassment or shame about how the patient behaves. even though they may realize the dementia is causing the person's odd behavior. Having known the person before their dementia, they know the person would be mortified if they realized how they were behaving now. Or not having known the person before, they don't have any idea how this person was before the disease. The caregiver may feel anger directed toward the patient. The caregiver may well feel angry about the level of care the patient requires and the disruption this causes in their life or workday. Sometimes these feelings can lead to neglect or abuse of the patient. Sometimes anger can be directed toward the caregiver themselves or toward others. Caregivers may feel angry at themselves for not handling things better, or at others for not helping more. Reactions that result from anger may be difficult for the caregiver to identify because these strong feelings are often not considered nice or acceptable ways of feeling. They may be expressed as the caregiver feeling that life is unjust and unfair, wondering why this terrible thing has happened. Or they may be obvious as the caregiver criticizes other family members or healthcare staff. Caregivers may also feel uncomfortable about the behaviors of the demented person. This discomfort sometimes causes caregivers to avoid being around the person. Caregivers often feel guilt about the emotions they feel and sometimes over decisions they have made regarding the care of the demented person. They may feel they should be able to handle themselves better or should have done more in the past or now. Caregivers often judge themselves harshly and feel guilty, even though they are doing their best. What can the caregivers do about having these feelings? Think about your own situation or one you experienced in the past. You may be a family caregiver or a paid provider working with dementia patients at home or in an institution. In any case, uncomfortable feelings can arise. Strong feelings are felt by many caregivers, and you are not alone in having them. There is no use or purpose in denying that your feelings exist. They arise from the values and beliefs you live by and cannot be ignored. Feelings are important for letting us know our areas of strengths and weaknesses. If you have a strong negative feeling about some part of caregiving, use it as a signal to yourself. It may be time to ask for help with this part of caregiving. Find someone to talk to about your feelings. If you are a family member, join a support group if possible. If you are a paid provider, talk to your supervisor or another paid caregiver for advice and assistance. Find others who are familiar with the problems caregivers face and talk to them. Look for ideas and solutions from others who have had experience caregiving. You may be surprised to find that many others understand how you feel and will help you to feel more comfortable with your own reactions and feelings.